Alright, welcome back to the Philadelphia College of Osteopathic Medicine, Georgia Campus School of Pharmacy, ASHP-SSHP Clinical Skills Competition Case Number 2, the ASHP 2010 Local Case for Syphilis/Neurosyphilis. Continuing on, my name is Michael Cooley of PCOM, Georgia, ASHP-SSHP Student Chapter President for the academic year of 2017-2018. I'm currently a P3 working with faculty and staff to provide an example of a Pharmacist Care Plan. Diving into the legality, my view doesn't reflect in any way the view of the faculty and staff, the school, and of ASHP. The school has no financial ties or disclosures. This information is not sponsored by ASHP, and for completeness sake, this information should never be used as medical advice or substitute for a medical professional. This slide is just for your review. Remember that you can make your soap note however you like. Just make sure to follow a consistent format throughout. As you will see many different types of soap notes and pharmacist care plans in your career, always look for ways to improve. And just in that sense, please leave your comments and concerns in the comments below so that we may improve our sessions. These are just examples of the printed references that will be handed to you during the national competition. Please take a look at all these materials and practice with your partner to see which one suits your preference. Before we go any further, I'm just going to give you my acronyms that I've been using to practice. For my subjective, I have All Smash FM with Fed Tacos in the social history. That stands for allergies, social history, past medical history, surgical history, history of present illness, family history, and medications. My objective has VAPE, or my vitals, my physical examinations, and my labs. Alright, jumping into the subjective, let's take a look at the allergies. Now we have an unknown name of the prescription, but we have urticaria associated with the injection when they were treated for an STD. This serves as a moment of judgment for you because there are only certain options available for injectables for STDs. Now, assuming that he was treated for primary syphilis when he came into the clinic, it would be indicative that he had a penicillin allergy that now requires desensitization or testing before giving him another shot. Looking at his past medical history, we can see that he has hypertension, premature ventricular contractions, a right knee fracture, and multiple STDs. Alright, let's take another look at his prescriptions. When we look at it, we can see that he's taking Tylenol for his right knee pain. But if you were to calculate the total daily dose, we can see that he's taking an excessive amount of Tylenol. He's actually taking close to about 8 grams a day. Taking a look at his social history, we can see that he's currently using marijuana, tobacco use at about 1 pack per day for the past 35 years and continues to smoke. He also drinks about 1 to 2 drinks per day and has about 2 cups of caffeine per day. Alright, let's go into his objective. We can see that his vitals, he has an increased BP on multiple days, and that's definitely a point of note, especially regarding his hypertension. For his physical exam, we can see that he's tapneic. We have a decreased range of motion and strength in the right knee, indicating damage and stress still currently present. But his labs, now this might be something that you might overmiss, especially if you haven't had the therapeutics, but you can see that he has HB, or hepatitis B, SAB. That's the surface antibody, and that he's also present for HB, hepatitis B, C, or core antibody. When you have antibody or AB, that's indicative that you have immunity to Hep B, that means that you do not have to have any other immunity or any boosters of the shot. If, however, that said hepatitis B or HBs or C, AG antigen, that would be indicative of a current infection or a past infection of hepatitis B, meaning that you are not immune to the disease. Definitely a point to note. And that he is currently positive for marijuana in his labs. Going on to our assessment or our prioritized list, our number 1 disease state is neurosyphilis. When looking at our secondary problems, it should always be the causative or the risk factors, and in this case, his lack of sexual education or his promiscuity led to the disease state, and it must be addressed in this occurrence. So, for our number 2 problems, we have safe sex education, we have his Tylenol overdose, we have his discharge planning, which I'll talk more a little bit in the next slide, and we have his smoking cessation. You'll notice a lot that smoking cessation either varies between a number 2 problem or a number 3 problem depending upon the case. In this case, we have our number 3 problems as substance abuse, hypertension, and HIV testing just due to his increased risk. Alright, going into the last bit of the case, which is the plan, I want you to notice that every plan always has Mr. T, and that's monitoring and therapeutic endpoints, your recommendations of therapy, and your therapeutic goals. You really want to have every one of these questions answered in your plan, utilizing any of your references and any information that was accessed in the case. So for example, in this one, safe sex education, you have your monitoring parameters and your endpoints. But I really want you to notice the follow-up of the PCR and the chlamydia. It's always good to annotate in the case if something is awaiting review, so any of your lab results that need interpretation, and this way you can address it in part of your plan. Now, going back to the discharge planning, in this case is fairly old. New therapeutic guidelines indicate that you can make a PO conversion from the IV, which was not currently available at the time, which is why discharge planning was such an important role for them to make sure that they had IV infusions at home. And then, because of the increased risk for contracting HIV due to the MSM, or men's sexual relations with men, that is always an increased risk factor for contracting HIV. The big thing is that you'll notice in his PMH, or his past medical history, is the premature ventricular contractions. This was not mentioned at all in the case, even though it was something that is mentioned previously. And this is really due to the fact that on his EKG, it showed normal sinus rhythm. If something is well controlled in a case, oftentimes they really don't require you to mention it unless they want you to continue therapy. Thank you so much for joining us today, and I hope to see you guys again soon.